Hey everybody, this is Dr. Brett Moss at Moss Chiropractic of Inverness. So I just wanted to share with you today, a lot of my patients want to know, what can I expect after my first adjustment? And I think this is a great question. In my office, I've always typically found that after the first adjustment, most people are going to experience, and when I say most, I mean 90-95% of the people are going to experience at least some pain relief. They may very well feel like they're breathing easier. They may very well feel like the pain is, or the pressure has lifted. If they're experiencing headaches, they may very well find the headache goes away very rapidly. But overall, they're going to experience some, an overall sense of relaxation, comfort, and within the next 12 to 24 hours, not uncommon at all that they feel a definite difference in the amount of pain. And so that's the very first thing. The second thing that some people experience will be, some people are going, about maybe 5 or 10% of the people may actually get sore the next day or that evening. They may feel like they're a little sore wherever we adjusted the neck, the low back, and it's not very common, but even the ones who do will still tell you that they feel a lot better. They're just a little sore and achy, and there's a good explanation for that, and it has everything to do with lactic acid, muscles relaxing. In some cases, we've actually stretched some ligaments, tendons, and muscles. So it's a little bit like the first time you stretch or work out, you get that little bit of a sore, achy muscle feeling. The third thing that may happen is nothing. You may not feel any different at all. And it's not very common, but it does happen. And I find it's more likely and more common with people who've just had a car accident, right? So they're here for that, whiplash, that sort of thing. Or brand new injuries like a slip and fall. I mean, they've really hurt themselves. On the inside, on the outside, the patient may not look like there's very much going on. They're not bleeding. They don't have any big fractures, and everything looks fairly normal. However, on the inside, you have to understand the muscles, ligaments, tendons, sometimes even the bone itself has been stretched or even damaged. And so the reason that they really are not feeling any different after that first adjustment is quite simply their body's going to have to take time to heal. Just like anything, you're not going to feel any better until the body starts to heal a little bit. And that is very common, or almost always the reason for something that's not very common at all. Like I said, it's usually the car accidents, and they're so busted up, it's going to take a little bit of time for their body to heal before they can actually tell that there's been an improvement, right? So those are the three things that we typically experience. Almost everybody will tell you almost as soon as they get off the table, wow, I feel lighter. Not lightheaded, not weird, just light, like their legs move easier. Their head doesn't feel so heavy. Maybe they feel like they're breathing real easy. They can take a really deep breath. There's almost always some very, very interesting physiological changes instantly after an adjustment. And that's because the nervous system is controlling everything. So as soon as you affect that nervous system, you are immediately affecting the entire body, and you almost always see some sort of a positive change. So anyway, that is what you can typically expect after a first adjustment. I will also tell you this, typically an adjustment is painless. Now it is silly to think that an area that is really already hurt and really bad is going to be painless to adjust. And the analogy that I like is, it's kind of like a jammed finger. When you jam a finger, how often are you going to be able to move that finger without pain? It's going to hurt a little bit, right? However, it shouldn't be excruciating, nothing like that. And if it is, we don't adjust it until it's had a little time to calm down, right? So we do everything for patient comfort and to make sure that you have the best possible experience that you can get. And anyway, so if you have any other questions, leave them below, right? Or give us a shout, give us a call. We are available, and I love answering questions, okay? So hopefully you have a wonderful day. God bless, and I will talk to you soon, I hope. Take care.